As the African Mental Health Foundation's founding director, you have kept an active mental health research agenda alive for over 12 years. During that time, there was absolutely no funding. There was no money in East Africa or in Kenya. Could you tell us what your experience was, the lessons you learned, and in your mentee program, your mentorship program, would you teach it to some of the mentees we send you so when they come back, they could show us how to do it? Thanks.
Thank you very much, Steve. I actually did not know that you knew that bit of the history. But it is true, we've been in existence now for slightly more than 10 years. And we did most of the research without any funding by just mobilizing goodwill from different people, medical students, undergraduate students, postgraduate students. And once I got an award for the best article written in the African Journal of Psychiatry, and I gave it to the foundation. That was about 500,000 shillings, and that went a long, long way. However, things are changing a little bit better, for the better. Last year, out of the 15 grand challenges, grants that were given by GCC Canada, we managed to get two of them. That has helped us to build the capacity. We also had a grant from another Canadian organization, and that gave us some good footing. So what I think the most important thing is that where there is a will, there is a way. We've been able to do quite a lot of research with very minimal, or what you might call shoestring funding. As for the students, like the one I just shown you here, which was graced by our Vice Chancellor. Vice Chancellor will be the rector of the university, together with a few of his deputies. Those students actually did their PhD work with minimal funding. And I was there for them. And what I really need from you is mentors. I think there are times when I feel like crashing under the pressure. I was supervising 7 PhD students from including some from other universities, and I was doing it alone. And I can tell you, by the time they graduated, I almost got hospitalized. So it's very stressful. So I have come to this country to ask you, please come to our rescue. I didn't come to ask for money. I've come to ask for the expertise, the surplus expertise that we have in this country. Send your students over. As they collect their own data for their PhDs and postdocs, and as they publish, surely they will have an opportunity to work with my students, and they mentor them. I think I've reached a stage, as I've told my friend here and a few other people, excuse me, I'm not concerned about myself anymore. I'm concerned about tomorrow. I'm concerned about posterity. I cannot be a specialist in everything, but I have the opportunity and the privilege of being invited to come to this place. And if I had about 5 students, and I knew there was this kind of expertise in this country, I'll be able to tell one student, I want you to work with so-and-so, and I want you to work with these students from this university, and pursue this area, and make it a very attractive area for other people, and in the process also mentor other people. I'll get another student and link him or her to other people. And I'm sure by doing that, taking that kind of approach, we can make it. Your students will benefit, our students will benefit, the country will benefit because we do research together, we will publish together, And that way is a tomorrow after me. Please, that's my plea to you. Thank you.
I want to add something to David's comments. Your work is amazing and what you're asking is amazing. So I think that what we're also talking about is how do we do the global mental health matchmaking to make sure that we can help the will of those that are working so hard and making sure that there's continuity in the work and there's more to come. And one thing that I can share that going back, I didn't know that I was doing, when I first started working in Brazil, there was this amazing psychiatrist called Maria Tavares and Lovisi, who I included them in my work because they were interested, and they ended up working with other people, and now they have a hub on their own. And for me, it's so exciting to see that people that I connected. So I'm going to take your request, and we're going to move forward to do some matchmaking together, because I would love to do it, because I have children who are very interested in developing themselves and have partners in other parts of the world.
Okay. I'll give you my card. Please drop me.
We're meeting tomorrow.
And we start tomorrow.
Exactly.
I too want to, I too want to congratulate you on your approach and your thinking, and I'm particularly taken by your last statement there about worrying about the future, because when we worry about the future, what we have to think about are the children. And so my work in every country, I always end up with the idea of the lack of a language. The lack of a language that we're giving the children for the next generation to be able to help seek appropriately, to be able to express themselves. So we are always talking about dealing with the providers, and we're always talking about the policymakers. But what we're not talking about is how we're going to change this so we don't keep taking the logs out of the river, but actually we go upriver and we try to do something. So when I looked at what you put up there about what you were doing, I was struck, and maybe I just missed it, by the lack of the word teacher. And when we think about the kinds of things that Dr. Verdelli was talking about, and I think about my own work, what we need to do is do something with the children so that we empower them in a way that we haven't empowered them to date, so that they, in fact, take on a different mantle of what it means to be mentally healthy, and how do I get help, and who do I talk to, or do I talk, or do I just grow up with the stigma, and when I'm an adult, I wouldn't dream of talking about my problems because I know that it's going to get me in trouble. So I wonder in your work where the children fit in terms of, and the teachers, particularly the teachers.
Well, one of the grand challenges in Canada we won, we actually called it KIDS, K-I-D-S. And we will be dealing with the children aged between 6 and 12 to do exactly what you are telling me to do. So I don't know how you got to know that. But that's exactly what we are trying to do. We are talking to the parents, we are talking to the teachers, we are talking to the children themselves, we are talking to the Minister of Education, we are talking to the actually our partners, we are talking to the Minister of Public Health. I don't know what will be called now because there are some changes. So we are talking with everybody, including community leaders, the custodians of culture in the community. Everybody is a stakeholder, and that's the approach that we are taking.
So did you save a card for me?
Oh, sure. Well, for your
One last question. Is there anyone? Is there a question no one asked?
Thanks for the presentation. My name is Melangel Concepcion. I'm a second-year resident in psychiatry. And I was wondering what type of opportunity this research offers in terms of translating into the education we as residents receives and we get in general medical education, because from my experience, it seems that is the component is lacking. And it's really interesting because just thinking about a couple of patients I've seen in the last 6 weeks from different places in Latin America specifically, come from places in trauma, like trauma related to the militia. And whenever they call me to place a consult, it's basically completely something different that the patient is trying to communicate, because there's the cultural, not only the language barrier, but the cultural barrier. And I was wondering how can this give feedback back to our educations and how it's been addressed.
Well, I think Roberto will talk about the
Milton, hold on just one sec. To add to that, I just want to say, I think several times it's come up, this issue of stigma and that there's a body of stigma that lies with the non-mental health healthcare providers that we need to really think about from the educational stage, right, all the way through to the delivery stage. And how do we address that? So if you can broaden out the question.
That's where I was going in many ways, because one of the things that we have learned is that we're trying to do these things and we forget about teaching our children, right? In medical school, in psychology school, in social work school, in nursing school, some of these issues. And we're trying to offer opportunities, including research opportunities. And it's very important for all you to know that if you're interested, just like David was saying, you need to try to contact somebody about this, because we will help you. We never say no to anybody. We match you, and we try to get you somewhere. If it's not with us, it's with somebody else that would have the program that you would be interested in. So never hesitate to call somebody who's trying to do global mental health, because we're so happy to try to help you with that, including provide training in your institutions. For free, by the way. This is not about trying to make money. We would go to your places and do trainings because we're happy to do it. Of course, if it's not in New York, we need to figure out how we do it.
No, I was just going to say that the DSM-5 changes have an opportunity now that I'm hoping many of us will take, and there's a lot of room here for a lot of work in the next few years for developing training programs that have to do with the use of these tools, for expanding and improving on the tools. I only got a chance to mention the fact that there are other modules, but to turn these into a training program, not only at the trainee level, where it really belongs as well, but also for ongoing practitioners, people who have been in practice for years and still would benefit from a training program. So the idea of incorporating, using it as a focus for moving forward from here is a very tempting thing that we want to engage in.
I'd like to just make a comment, a little disconnected, but to address what Kathy said about stigma in the healthcare system. One of the things that we're actually doing as part of the hub, the U19, we have a shared research component that actually cuts across all of the hubs, and we are doing an examination of the barriers that obstruct effective task sharing from the psychiatrists to the community health workers. And one of the things naturally we're examining is stigma. So in terms of their preconceived attitudes, et cetera, and can we do this in an effective way? To what extent are we going to have to address community stigma?
I just wanted to say that if anybody is interested in helping develop that training process, please come and talk to me.
And by the way, I mentioned the paper, because I know they charge you if you try to access it. Email me and I'm happy to send it to you.
So thank you. We'd like to thank our panelists for a very illuminating and stimulating discussion.